Well, we're about halfway through the year and I can feel it because I'm getting a lot of phone calls of people saying, "Listen, my Medicare supplement just had a recent rate increase and it's pretty big. It's a big jump." So, what are my options? What should I be looking at? When should I be looking at it? So, if that is you, if you are on a Medicare supplement, doesn't matter an F, G, N, maybe even the rest of the letters, but most people I come across are on either supplement F, G, or N. There's going to be some pointers, maybe some things to consider in this video for you, maybe to rate shop. Maybe you need to stay where you're at. This video is going to help you navigate that change if needed. Let's get into it. So first thing, I'd like to just clear the air, and please don't think if you have a Medicare supplement, okay, F, G, N. So you've got original Medicare as your primary, then you've got a Medicare supplement as your secondary, then a standalone drug plan. That's the usual makeup of someone who is in that category. You can make changes any time of the year. Any time of the year. Please don't think you have to wait till annual enrollment period. October 15th to December 7th, every year, annual enrollment period is for Medicare Advantage plans and prescription drug plans, not for Medicare supplements. So, what does this mean for you, the person who maybe just experienced a rate increase or that rate increase is around the corner? Maybe you just got a notice from your insurance carrier saying, okay, effective July 1, August 1, on September 1, and you get the drift. Your new rate will be this much monthly. So maybe you've already gotten a heads up and you're wondering, what can I do? Well, you can actually at any time of the year change your Medicare supplement to a more competitive rate. The first thing, so that's the first thing. The second thing is, remember, the coverage follows the letter, not the company. So you can have a Mutual of Omaha Plan G, you can have a United Healthcare Plan G, a Cigna Plan G, Aetna Plan G, a Honey Nut Cheerios Plan G, and it provide the same exact coverage no matter which company you go to. So the coverage follows the letter, not the company. So the name of the game in the Medicare supplement space is just to make sure you are competitive every single year. You should be reviewing your policy, even though your policy is guaranteed issue for the rest of your life. That's the beauty of a Medicare supplement. You want to make sure you're competitive. Nobody wants to be overpaying for insurance where they can go get the same exact coverage with another plan. So this brings me to number 3. Now, in order to change, if you are outside your Part B, so take a look at your red, white, and blue card and then count 6 months from your Part B start date. If you are out of that period, that means you will undergo underwriting, which is simply yes and no questions, no paramed, no exam, no nurse coming out to your house. It's basically a database check of what is went on in your medical history and also what prescriptions you're taking. If you can pass those 2 steps in underwriting, then you will more than likely qualify for a new Plan G or a new Plan N, so on and so forth with another company. Now, each company has different underwriting. There are some companies that are very, for example, diabetic friendly. There are some companies that are not. So it's good to, maybe after you digest this video, contact your agent. If you don't have one, there's a link in the description to get a hold of me if you'd like. Just do a little bit of shopping, No, I haven't met a human being who doesn't like shopping, whether it be online or in person. So now let's figure out what to shop for. Because if you're on a Plan F, I'll tell you to consider a Plan G. If you're on a Plan G, I will tell you to consider a Plan N. And all of this is, the way I explain it is, okay, if I'm making a Medicare supplement margarita, shaking it up, shaking it up, shaking it up, and I say, all right, I'm going to grab the most top shelf most top shelf tequila, so to speak, that one can get. I'm going to reach for the very top shelf. That's going to be a plan F. The only thing is, if you didn't turn 65 before 2020, you're not going to even qualify for that. It's not going to even be an option for you. So for most people consuming this video and watching this video, it will be a plan G. The very top shelf I'm grabbing is that plan G. Just one shelf below that is a plan N, which is why I urge, if you are on F or G, to consider a plan N. Number one, especially if you qualify for a move, we don't know what your health is going to do in the future. You may not ever qualify to make a move again. I'm not fear mongering or anything. I just see this every single day. I'm trying to give you a heads up. So the N is very similar to a G, and then the G is very similar to an F. So if you're on F or G, again, let's get into why I'm telling you to consider a plan N. So here we have a comparison chart of G versus N. Now on the left you see G, on the right you see N, and you can see it is pretty much neck to neck, pound for pound, very similar. Let's talk about first the similarities, then we'll get into the differences. So the similarities would be, first, the part, let me take it out of order here. First, the Part B deductible. Let's go from the bottom top. How about that? The Part B deductible in the year of 2025 is $257. So the first $257 of your Part B is going to come from you. After that, here is where things change. After that, if there is an excess charge, which don't worry, we're going to get into that, not covered by an N, covered by a G. Part B coinsurance. Okay, so after the 257, you have these two copays to worry about. Up to $20 copay for office visits, up to $50 copay for ER. So after the 257, expect to pay, if you walk into the doctor's office, $20 on a plan N. Expect to pay $50 if you go into the ER for a plan N. On a plan G, that is covered. And for the purposes of just easy speaking, you can see you're 100% covered outside of the deductible for a plan G. So for a lot of Americans after the 257, it is very easy to just go in and to every single appointment and just not getting used to not paying a copay. So if you are used to that and you value that over saving a little bit of premium every month, I would say to stick where you're at, either with a G or an N. But again, this whole video is meant for those who are maybe want to look at options, because their rate increase was just not very attractive, this last one, or isn't going to be. So those two are the main differences. So after you hit the 257, again, $20 and $50 copay, those two copay scenarios. On the hospital side, you get stuck in the hospital with a plan N, it's going to provide you the same coverage of a plan G. So let's get into the elephant in the room, which is the excess charge. What is that? Oh, darn it. Oh, darn it. Anyways, all right, key takeaways. So for the plan G, there are no copays. There's no excess charges, which is why there's a slightly higher premium than a plan N, where there is lower premium, but you pay the copays and potentially, see there, that's a keyword. If I had sense to bold it, I would, and capitalize it, rare excess charges. Okay, what the heck is an excess charge? And by the way, I'm backing all this up on AI. So AI is pulling, like ChatGPT is pulling multiple sources together. I prompted it and I said, what is the heck is an excess charge? And what is the statistical probability that this was happened to somebody considering a plan N? So here we go. What is it? Most doctors accept what Medicare pays them as full pay. Okay, so accepting assignment. So a good rule of thumb is to when your doctor is wanting to see you or perform a certain kind of service, do you accept Medicare assignment? And most doctors will say yes, which means most doctors will not charge up to 15% more than the Medicare approved amount. That's exactly what an excess charge is. It's a charge that is up to 15% more of the Medicare approved amount. Okay. It literally says this extra cost is called an excess charge. The good news is over 95% of doctors accept assignment. So excess charges are very rare, and in some states they can't even do it. So if you have a plan in, you may have to pay these charges, but most people never actually see them. So what to know about excess charges? Some that some do, and by some we're talking that very small percentage. So if doctors accept accept Medicare assignment, no excess charge. If they don't, you may be in charge up to that 15% in excess. Just the 15%, not the entire thing, just the 15%. So why am I saying this is because there's about 30, and in some states, a $40 difference between an N to a G. So you can just imagine if you're on a plan F and you're thinking, well, heck, I can handle a $20 copay here and there. I can handle you just do the math. That is the one thing that is like what I preach on is let's do the math. I'm not even good at math. So bust out your calculator and calculate what your monthly premium is, whether it be an F, a G, an N. And by the way, if you're already on an N, that means you did a lot of research and probably understood a lot of this, which is why you went to a plan N. So my advice is to you just to stay competitive, see if there's another company, reputable, financially fit company that is at a lower rate than your next rate increase. That's a great way to go about if you're already on a plan N. But if you're on an F or a G, do the math. Multiply your monthly premium times 12, and then find out what a plan N monthly premium is. And you can do a lot of this on your own. I'd recommend using an agent because us agents know exactly which company to pair you with. There's a lot of discounts available with all these companies. So use an agent, but you can go on Medicare.gov and search for a plan in your area. Multiply that times 12. You can see the annual premium difference. Again, the $257 is going to be the deductible that neither of those plans cover. But just take a look at your history and how often you're going to the doctor. Add those copays into the annual premium that you're paying, that you would be paying for a plan in, and I'll bet you that it is less than a plan G, and it would be less than the plan G even if you had to see the doctor, maybe 5 more times than you usually do. Now, this move to a plan in probably isn't good for those who maybe see a doctor twice a month already. Maybe you're about to enter into something in maintaining health, and maybe if it just don't make sense up here to you, if it is just clear as day and easy for you just to go with plan G, go with the plan G, but just stay competitive with your plan G. That's my point of this video. Whether it be an F, G, or N, stay competitive. And then also understand that there is a plan in that is a lot of people just they grab the top shelf, the most expensive one. Let me grab that top shelf because it's probably going to be the best and cover the best for me. But just understand that one shelf below is just 2 copay scenarios, and then the excess charge, which I always say this, you're probably more likely to get hit by lightning than to experience an excess charge. And even then, it is somewhat preventable. So consider it, and you may like it and find that you've got some extra money to do things you want to do. Anyways, I hope this video helped. And like I said, the link in the description is to get a hold of me if you need a little bit of help shopping around. But stay tuned for the next video. I'm happy to make these and hope you get a lot out of them. Bye-bye.